We want to get to our top story right now. It is the coronavirus and all of the overnight developments. 3 states starting the process of reopening non-essential businesses on Friday. Georgia, Oklahoma, and Alaska opening their doors to customers with new guidelines in place. And in the next week, nearly a dozen other states will start to ease their restrictions as they slowly start the reopening process.
The death toll here in the U.S. has now risen to more than 51,000, with the number of cases hovering above 900,000. Last week at this time, there were 700,000 cases. But thankfully, there is some hopeful news from New York State, the epicenter of this outbreak, where the death toll has dropped to its lowest level in weeks.
Our team is again covering all of it this morning across the country and across the world. We want to begin with NBC's Sam Brock. He is in Atlanta, where Georgia is getting back to business. Sam, good morning.
Peter, Kristen, good morning. Within the last 24 hours, the governor here has given the green light to barbershops and salons, spas, massage parlors. Business owners right now trying to figure out how this is going to work. Step inside with me for a second and you'll see no more than 10 people inside at any given point. Everything has to be sanitized. And Peter and Kristen, caution tape down here where customers would normally be sitting.
This morning, Georgia, a national flashpoint. Stores that were forced to close for weeks because of the deadly coronavirus now open for business, drawing controversy.
The fact that salons can be open, I don't know why that's essential.
Salons, spas, tattoo parlors, gyms, restaurants, and movie theaters, among other businesses, all getting the green light. At the Thomas Barber Shop in Atlanta, temperature checks and employee masks are new, with the owner of this half-century-old business encouraged.
We're cleaning our chairs, we're cleaning our backboards, our scissors, our combs. It is better today than it's ever been.
The strength of the blueprint, based on social distancing requirements and Governor Kemp saying he's informed by data and public health recommendations and hospital capacity. But Georgia's COVID-19 cases have actually been going up throughout the week, when federal guidelines say they should be going down.
I didn't like to see spas at this early stage. Spas, beauty parlors, tattoo parlors, no.
Presidential criticism for Kemp coming as states like Alaska open up restaurants and retail. In Oklahoma, it's salons and spas, where some owners enforce strict rules.
I want people to be able to come and get a good haircut, not leave with COVID.
Even in Texas, where stay-at-home orders remain in effect, this salon owner isn't fazed.
It is their personal choice as an American to come into the salon if they want to, and they have that right.
Americans from Wisconsin to Georgia are exercising their right to protest the plans.
We're not disposable just because, we're low-income people.
Employees worried about the risk of return, as some owners, like Brant Gully at Spring Cinema and Tap House, will not bring back his theater when eligible Monday.
It didn't then, and it doesn't now feel yet like it's the responsible thing to do.
Yet with safeguards in place, other business leaders say the cost of staying closed is also considerable.
What's the worst evil? Everybody staying at home and killing the economy. There's a fine line there.
And on Monday, movie theaters and restaurants will also be opening, but in the face of intense criticism from President Trump this week, Governor Kemp coming out with 39 new guidelines for which restaurants would be opening for dine-in services. Peter?
Sam, you're on the ground there. How many people came out on Friday to these newly reopened businesses?
For the businesses that are open, a lot. This barbershop does not usually take appointments. There were people coming around the clock. They had to set them for next week. There were so many because you can't have more than 10 people inside. I will say this, though, Peter. I probably went to about 30 different businesses across the board. A handful of them were open. Most at this point are putting in phases to figure out how it's going to work, but have not yet opened their doors. Peter and Kristen?
Yeah, it's still clearly a work in progress there. Sam Brock in Atlanta. Sam, thank you very much.
President Trump is facing intense scrutiny after his comments earlier this week about whether or not ingesting disinfectant could help kill coronavirus in the body. On Friday, the president held his daily briefing, but left before reporters could ask him any questions, which is a first for him in this crisis. NBC's Kelly O'Donnell is at the White House with the very latest. Kelly, good morning to you.
Good morning, Kristen. President Trump has said he's just trying to offer up ideas to get rid of the virus, even though some of his suggestions about light or chemicals used for medicinal purposes have drawn ridicule and warnings from the scientific community. And the briefings that he's made a centerpiece of his daily schedule are at issue, with advisors and allies saying he should do fewer, shorter briefings, a tactic that showed up on Friday. After boasting about TV ratings and sparring with reporters for weeks.
You guys ever stop? Do you want to keep going?
A twist on the drama Friday. Brief comments, and then President Trump headed for the door, taking no questions. Earlier in the Oval Office, the president tried to deflect his widely condemned suggestion that disinfectant could be considered for internal use in COVID patients.
I was asking a very sarcastic question to the reporters in the room about disinfectant on the inside. But it does kill it, and it would kill it on the hands, and that would make things much better.
But no sarcasm was evident when the president turned to his medical experts, not reporters, to suggest they study ingesting disinfectant.
And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs.
The president's idea followed a Homeland Security official who discussed UV light and disinfectant killing the virus on surfaces, not inside people. The president pressed Dr. Birx, who softly shot that down.
Deborah, have you ever heard of that?
Not as a treatment.
Friday, the FDA also issued new caution against the outpatient use of a drug the president has repeatedly promoted, hydroxychloroquine, citing reports of serious heart rhythm problems in COVID-19 patients. The FDA is conducting clinical trials. And the president signed the latest relief package to aid small businesses, which includes billions for hospitals and testing.
So, Kelly, there is no briefing on the public schedule today. Moving forward, could we actually see fewer briefings? Is this going to be a new strategy now?
Well, it seems, Kristen, that the advice the president has been getting for some time, going back a few weeks, not just revolving around this controversy, had been that fewer briefings, shorter briefings would make sense because the president was at risk of being overexposed. At the same time, there are advisors who are saying, as the country is beginning to reopen, this crisis approach of a daily briefing should be reduced in order to give the country confidence about reopening. So those are some of the conversations that our collective reporting has shown behind the scenes. And as you point out, there is no briefing on the schedule today. Now, in the past, we've seen the president add one. Will he do that today? Based on this new advice, perhaps not. Kristen?
Yeah, we've seen him change his mind before. All right, Kelly O'Donnell, great reporting as always. Thank you.
We want to bring in NBC News medical contributor Dr. Kavita Patel. Dr. Patel was a top health official in the Obama White House and is now working with the Trump administration on its return to work policy. Dr. Patel, good morning. Nice to see you.
Great to see you, Peter. Thanks.
We want to ask you about these businesses that are now beginning to reopen in those states, including states like Georgia and Oklahoma. Obviously, businesses like nail salons and tattoo parlors, there's no way to do that from 6 feet apart. You're right up next to the client or the stylist there. What is the risk of more cases being passed on, more infections as a function of this reopening?
Well, it's a pretty high risk, and as you've already mentioned, the numbers of cases are, in fact, increasing in that region, not declining, which is actually one of the first criteria that the Trump administration, as well as other public health experts, have cited. In addition to that, Peter, really having these reopenings occur now, just when there is, even in some parts of the country like New York, a decrease in cases, can only exacerbate the problems on hospitals and healthcare workers. So really, having the ability to buy some time for the healthcare system to deal with new cases is exactly why most of us need to stay at home. And I know it's hard for the economy, but we are going to see the effects of it in places like Georgia.
And Dr. Patel, as we said, you've been working with the administration on this critical issue of testing. That's really at the crux of trying to reopen the country and the economy. So where are we right now when it comes to testing and as it relates to potentially reopening?
Yeah, so the administration, especially the FDA and officials at HHS, are working at breakneck speed to try to have as many tests approved with high quality and rigor as possible. However, I think it's pretty important. Right now we're doing about 185,000 tests a day, and even with kind of more approvals of tests themselves, at-home tests, et cetera, it's still going to be probably a little bit short of a million tests a day, Peter and Kristen, in a matter of months. And the trillion-dollar question is that enough testing? And what we're really trying to explore in regions, states, and cities is that you can't just have the testing. You need testing and the ability to do tracing. And so you'll see in the last 2 days, there's been an expansive call for people who can do contact tracing because we know we're going to have new cases, and testing alone will not be enough.
And Dr. Patel, the big headline out of yesterday's White House task force briefing was the FDA announcing the first at-home testing kits are now available. How exactly would these work, and how accurate are they?
Yeah, it's a great question. And right now, just to be clear, those tests for even at-home use are going to be first offered to healthcare workers and kind of higher priority personnel, essential service workers, et cetera. It is a simpler test. It's not as invasive with a swab that has to go all the way to the back of the nose. It just uses a swab that can be pretty easy to self-administer, and then it's put into a kit and then sent out for processing. You're not processing it yourself at home. So it is safer. It minimizes the use of that protective equipment. We're still weeks away from seeing it being used beyond some of these essential workers. But again, Peter, it's not millions of tests. We're talking, tens of thousands and hopefully more, but we still need more.
Certainly a development that got a lot of attention yesterday. Dr. Patel, it's hard to believe, but we have been at this now for over a month. Social distancing, all of the work that you have been doing to develop testing and expanding that. We're still seeing thousands of people die every day. Looking to the future, what are you anticipating in the coming weeks and months?
In the coming weeks, I'm absolutely certain that we're going to see everybody concentrating on expanding testing as much as possible. But as I mentioned, also simultaneously starting, and already many of us have been working on plans to think about tracing and isolation. So here's the new normal many Americans can expect. We're going to still have a lot of social distancing measures in place, or encouragement, like you saw, for businesses to learn how to do social distancing. It'll be highly encouraged. In fact, all of us, myself included, using non-medical masks wherever possible, minimizing shaking hands. We're not going to be standing in packed lines to go through airport security. So these are things, until, Kristen and Peter, we have better treatments and a vaccine, which are all on the horizon. So let me just be clear. We do have hope, but it's going to take time for Americans to function a little differently until we can really tackle this virus more comprehensively.
Dr. Patel, we appreciate your expertise and your time. Thanks very much.
Thank you.
Thanks for the great information. Another angle we're tracking this morning, the U.S. Navy captain who was fired earlier this month after warning about a coronavirus outbreak aboard his aircraft carrier may be getting his job back. NBC's Geoff Bennett has the latest on that.
This morning, top Navy officials are recommending that Captain Brett Crozier be reinstated. Crozier was relieved of his command of the USS Theodore Roosevelt after sounding the alarm about a coronavirus outbreak on his ship. This was the scene earlier this month as the thousands of sailors who Crozier fought to protect gave him a rousing send-off as he disembarked the ship for the last time. Pentagon officials tell NBC News that Defense Secretary Mark Esper has received the reinstatement recommendation from top Navy brass. Esper's now deciding whether to sign off.
I spoke with the Secretary about this yesterday, and his position remains the same. He's going into this with an open mind, and he is generally inclined to support Navy leadership in their decisions.
It all comes 3 weeks after the captain was dismissed for sending a letter to Navy leaders begging for help for his ship's crew, hard hit by a coronavirus outbreak. "We are not at war," Crozier wrote earlier this month. "Sailors do not need to die." The sideline captain himself tested positive for the virus after leaving the Roosevelt. At least 856 sailors on the aircraft carrier have since tested positive too. including 41-year-old Chief Petty Officer Charles Robert Thacker Jr., who later died. Then Acting Navy Secretary Thomas Modly blamed CROZIER for not appropriately going through the chain of command after his letter was published in a San Francisco newspaper. Modly stepping down after fierce backlash over these disparaging comments about CROZIER to his former crew.
He was A, too naive or too stupid to be the commanding officer of a ship like this.
Captain CROZIER now awaiting final word about his future. For today, Geoff Bennett, NBC News, Washington.
Meantime, as the debate rages here in the U.S. about how and when to reopen safely, some countries in Europe are slowly beginning to do just that. Could they be a model for us here in the U.S.? NBC's Sarah Harman is in London this morning with more. Sarah, good morning.
Well, Peter, good morning. Here in London, we are still on lockdown until at least May 7th. But over in Germany, they're slowly beginning to reopen parts of their economy. They're also doing something else: wide-scale random antibody testing.
Hello, good morning.
It's not every day a doctor and a police officer show up at your door and ask for a blood sample.
Good morning.
But this is now a common occurrence in the German city of Munich.
I would say around 80% of the people, they say, oh, we've already heard about the study. Actually, we are really happy that we've been selected, and we are happy to take part in the study.
Researchers there are now carrying out wide-scale random antibody testing to find out how many people have already had the virus.
We thought that we need a kind of indicator at what time we can release the lockdown.
The World Health Organization cautions we don't yet know if having antibodies makes someone immune, and if so, for how long. But scientists hope that understanding the true infection rate and how the virus spreads inside a household will help shape decisions about easing the lockdown.
Why did you want to be part of this study?
You know, it's only 30 minutes that you have to invest in this. But more important to me is you can support science.
Germany has been widely praised for its efficient response to the virus, with the capacity to administer more than 100,000 diagnostic tests per day. Its official death toll at just over 5,500 people is lower both overall and as a percentage of its population than the U.S., Spain, or Italy. Now they're beginning to ease the lockdown, reopening some shops and a Daimler plant, resuming Bundesliga soccer practice, and gradually sending students back to school, while strongly advising people to wear masks in public. German Chancellor Angela Merkel, who has a doctorate in physical chemistry, is urging caution. She says despite the country's fragile success, Germany is still at the beginning of this pandemic. Peter, Kristen.
All right, Sarah Harman on the ground in London for us today. Sarah, thank you.